Evaluation matters. In fact, this is the title of our new evaluation policy documentation. And on that we try to stress one thing, that we have a good track record on having done ex post evaluations, but we are still dissatisfied the way it is being fed back into the system. I want to be quite honest with you. So far, evaluation, even if they're interesting, are too much still an afterthought of what we're doing, but we would really like to make it, in fact, the starting point of any of the policies. And I'm sure with the new evaluation policy, again under the good title "Evaluation Matters," also the way we can use current evaluation results would help us to gradually shift this and hardwire this better into our system. Budget support is a modality. So in the programming exercise, we have not always already prescribed as to whether we would use project mode or budget support as a modality. This is really something we decide and firm up in the identification phase. But this said, overall, you would hope that the sectoral concentration we do have, the type of sectors we are looking at, would lend themselves that for the most part we can either do sector reform contracts, sort of to focus on that part of the modality, or in fragile states also use the state building contract as a modality. So overall, I would still continue to believe that we would see over the period that it remains a preferred modality for the bulk of our bilateral funding. The Mozambique evaluation is great. I mean, great to read for anyone who is in the business. It's a fabulous country to do it. I mean, we looked at 10 years, but not just at 10 years of Commission funding. We looked at 10 years of funding also from many other donors, and we could also correlate this with projects. Now, the results I've taken out of that are maybe 2 or 3 main aspects. The one, it is a very clear proof of the effectiveness of budget support. It clearly helped the Mozambicans to improve social service delivery. And the funding which came from us did not substitute Mozambican funding. No, in that period also the Mozambicans actually increased social spending in education and health. Some of the figures of improvements are impressive. Education, notably, that between 2004 to 2012, I read that primary coverage has improved by 60%, and also that we managed to reach many poorer households. Now, this is the one, I think, very firm aggregated result of the evaluation. There's a second one which is interesting, namely that one would have to look at social spending more carefully. That the evaluation shows that social spending and targeting has improved over the time, but it has not yet improved sufficiently that Mozambique could also narrow the gap of poverty in the country, but rather that we still see pockets of a widening income disparity. And this is something we could usefully draw from that evaluation to make sure that this is being more prominently addressed. And then thirdly, the evaluation confirms the obvious. I think budget support is a very good tool to help drive reforms, but that it's not a forceful tool enough to enforce reforms where the government is not fully committed. Now, in the case of Mozambique, I would like to say that very much to the credit of the government, they really woke up to the challenge of working along with us, with the consultants, work with the results, help us to present that both in Maputo and here in Brussels, and are very open and very committed to also for them to take up the lessons. That's also why I think we should also take up the lessons, feed this back more generally into our budget support modality, but also feed it prominently into the way we would do business then in Mozambique in the years to come.